Have you or a loved one had a concussion and wondered if chiropractic care can help you? Were you told that your concussion would just get better with time, but time has not cured it? Hi, I'm Dr. Matthew Collins. I'm a chiropractor. I'm board certified in rehabilitation, and I'm fellowship trained in primary spine care. In addition to my training, education, and experience, I've been managing for decades patients with concussions. Now, please know, these videos are not a substitute for professional medical or chiropractic advice, diagnosis, or treatment. These videos are strictly for educational and informational purposes only. Seeing the wrong doctor with some of these conditions can result in an incomplete diagnosis, wrong treatment, and persistent symptoms with poor recovery and unfortunately sometimes no recovery. So let's jump in on this topic of chiropractic management and concussions. There's an excellent article that I'm using as my reference today, and it's one written in 2015 by a medical doctor at Jacobs School of Medicine in New York. The doctor's last name was Letty. The article is titled Brain or Strain, strain meaning neck strain. The subtitle of this article says it all. Symptoms alone do not distinguish concussion from neck injury or inner ear injury. So what does this mean for somebody who is a patient? Well, simply, the symptoms from a concussion may look like a neck injury, or in reverse, a neck injury may produce symptoms that look like a concussion or an inner ear injury. So just to repeat this another way, since the symptoms of one injury may mimic the symptoms of another injury, this can, you guessed it, lead to a wrong diagnosis or an incomplete diagnosis. This is very important for patients who suffer. So there's a few more details in this research article that I just want to cover with you. One would assume that the common symptoms from a head injury would be things like memory issues, concentration problems, emotional issues, sleeping too much, sleeping too little, even balance problems. One would assume that the common symptoms of a neck injury would be things like neck pain, restricted neck range of motion, headaches, and such. Well, the problem with this in the real world, oftentimes the diagnosis of brain injury is diagnosed just simply listening to the symptoms of the injured person. There really is no way to see brain injury on X-ray or MRI, especially the concussion type injuries outside of really bad bleed on the brain, which is really not what we're talking about here. So the authors found out that many patients ended up being misclassified. So what do we do to fix this issue? It's rather simple when you step back and think about it. Any patients who have had a head injury or symptoms of a head injury, they should make sure that they have had a thorough neck evaluation and possibly even an inner ear evaluation. Here's one of the main reasons. A blow to the head or neck is really not very specific. If you hit your head is attached to your neck, and the neck can easily be strained. Inside of the head lies the inner ear. This can be jarred. Now on the flip side, having a neck that is injured, well, it too is attached to the head, and this can result in the head being injured. So it doesn't matter where the patient reports the pain. They're all connected, and they all really should be assessed. So remember the following. Headaches or cognitive issues do not automatically mean that you have a head injury, but they don't mean you don't either. You could have a head injury, you could have a neck injury, or you could have both, or you could have an inner ear injury. So if you or someone you know has been diagnosed with a concussion, has had a head injury or a neck injury, and you're not getting better, you need to be examined. Give us a call at Twin Cities Headache, Neck and Back, 651-925-5530. We are here to help you. You have many videos to pick from, and I am glad that you chose mine. I hope this helped you with your decision making. I wish you all the best, and until next time, be blessed.